Every day I go to work down Richards Boulevard. And it's by Loaves and Fishes, and we want to get the people before that. Because when people get that far down, they need food, shelter, this is so important. But before that gets that low, there's this place that some people find themselves, and they start to lose their job. Maybe family members fall away from them because they're too much for them, because they're untreated, or maybe they have trauma.
The foundation is trying to address a gap in services that exists because most social service agencies don't have the staff or the money to provide real in-depth psychotherapy or counseling.
A lot of clients I'm hearing are just really frustrated with not being able to find providers. And when they find Middleway Health, they're just completely like, really, this is for real?
When services are free, we don't have to say, well, we need to check your benefits.
What's out there currently sometimes just doesn't meet the needs for people, and or there's just so many barriers to the access to resources that it's just really unfair.
So our intake form is very simple, very straightforward, and I like information to come out in a relationship, in the counseling session, instead of checking off boxes. And people do better when things are calm and safe, and it is calm and safe here, and it's comfortable.
Premiumbeat.com.
Your value as a human being is mirrored back to you by your neighborhood, by your school, by the mental health services that are offered to you. Stephen Walker has created this beautiful environment for all people, and that mirrors back to that person. It's a message. You have value. We make this beautiful for you. I'd like people to know that there's somebody that cares. Not just a little bit, like really cares. And if you don't show up for your appointment, they notice and would even call you.
I can tell when a patient is starting to feel better or starting to get some relief is when they start feeling energy to like go and do things.
A good marker is people are doing better when they're not self-isolating, when they're not getting into conflicts and fights, when they're doing something creative, when they feel just a sense of well-being in general.
Sometimes patients will start feeling better and just don't have time for therapy anymore, so they'll start missing their appointments. And that's another sign that perhaps they're ready to go out on their own, but they don't want to hurt my feelings or something, I don't know. But I'm always like, are you ready? You ready to like go live your life, and it's okay,
If we heal ourselves, we each of us, no matter who we are, can pay it forward and be that light for somebody else.